Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Red veins in eyes causes and how to treat bloodshot eyes. Red veins in the eyes can have multiple causes. Eye redness occurs when small blood vessels near the surface of the eye, for example, red veins in your eyes, become swollen. It can affect one or both eyes. /r/n/r/n The most common causes of red and bloodshot eyes are painless, but serious conditions, like a corneal ulcer, can be quite painful. /r/n/r/n You can temporarily develop bloodshot eyes after drinking alcohol, staring at a computer screen for too long, or forgetting to change your contact lenses. However, red-veined eyes caused by an eye injury or infection may need to be treated by a healthcare professional. /r/n/r/n Illustration by Tara Anand for Verywell Health /r/n/r/n Contact lenses can be irritating to the eyes, causing red veins to appear. Some common reasons contacts may irritate your eyes include /r/n/r/n Sometimes contact lens complications can cause corneal abrasion, a scratch on the cornea that can then become infected and result in an infectious corneal ulcer. /r/n/r/n If you have bloodshot eyes associated with contact lens wear, see an eye doctor right away. They will check for possible complications and provide the correct treatment. /r/n/r/n Do you reach for eye drops when you wake up with bloodshot eyes? Watch out for drops that include ingredients that constrict blood vessels such as tetrahydrozoline HCL. They can become less effective as you build up a tolerance to the drug, and they can cause rebound, returning, redness when the drop is stopped. /r/n/r/n Using over-the-counter, preservative-free lubricating eye drops is usually a safe bet to try before consulting your eye doctor. If your red veins persist, they can help you identify the cause of your bloodshot eyes and prescribe a safe and effective treatment. /r/n/r/n Red, dry eyes result from a lack of moisture to the eyes. Your tears work to replenish moisture to the eyes by blinking. /r/n/r/n Blinking is one of the fastest reflexes of the body. However, people tend to blink about half as much as normal when working on a computer. This is known as computer vision syndrome or digital eye strain. /r/n/r/n Try to reduce redness by blinking more often. You can also replenish moisture in the eye by using artificial tears. /r/n/r/n If you don't get enough sleep, your eyes may show it. Losing sleep tends to increase blood and fluid around the eyes. This makes them appear puffy and red. Lack of sleep can also lead to dry eyes. /r/n/r/n Your eyes need rest to clean and renew. Unfortunately, when you don't get enough sleep, your eyes don't get the long rest they need for proper fluid circulation. /r/n/r/n Be sure to get a good night's sleep for overall eye health. Most adults younger than age 60 need between 7 and 9 hours of sleep. It's a little less in people 60 or older. /r/n/r/n Many people develop red veins in their eyes after spending time in a pool. Redness occurs when the chlorine used in many pools causes the eyes to become irritated. As with other causes of bloodshot eyes, this leads blood vessels near the eye's surface to become enlarged and dilated. /r/n/r/n If you are prone to getting bloodshot eyes from swimming, wearing swim goggles in the pool is a good option. /r/n/r/n If you have blurry vision and eye pain, make an appointment with an eye doctor as soon as possible to rule out an infection associated with swimming. /r/n/r/n Smoking a cigarette releases several harmful chemicals that can irritate the sensitive tissues of the eyes. It also leads to dry eye irritation, disrupting the tear film layer and leading to symptoms of eye inflammation and bloodshot eyes. /r/n/r/n See your healthcare provider to discuss your eye health, and consider strategies to quit smoking. Some studies suggest smoking, and secondhand smoke, can increase dry eye and the risk of other eye diseases, including cataracts, cloudiness in the lens of the eye, and macular degeneration. r/n/n. Drinking alcohol can cause some people to develop eye redness, most notably females. This is because alcohol can cause vasodilation, widening of blood vessels. /r/n/r/n. Alcohol is dehydrating and can cause the eyes to appear red and tired. It's well known that using cannabis causes bloodshot eyes too, whether you smoke the plant or consume it as an edible. /r/n/r/n. Vasodilation and eye redness happen because substances affect the surface of the eye. In the case of cannabis, however, there's also some evidence of a pathway for the treatment of glaucoma, a pressure-related eye disorder. /r/n/r/n. The only way to avoid bloodshot eyes due to alcohol or cannabis is to avoid using them. Using OTC eye drops may temporarily relieve redness, but the redness will likely reappear when you use alcohol or cannabis again. /r/n/r/n. You may notice red veins in your eyes due to allergies. In addition, red eyes from allergies often burn and itch. /r/n/r/n. With allergies, the eyes become a red because the blood vessels in the front part of the eye dilate and become larger. As a result, fluid accumulates and causes swelling. /r/n/r/n. You can treat this type of redness with cold compresses, artificial tears, avoidance of triggers, and OTC allergy medications. /r/n/r/n. Treatment can also include eye drops targeted at allergies. Note that systemic allergy medications, those that affect the full body, can dry out the eyes and worsen eye reddening. /r/n/r/n. Pregnancy causes large changes to several hormones in the body. These shifts can cause the body to produce fewer tears, so your eyes may feel irritated or gritty. In addition, they may appear red and be sensitive to light. /r/n/r/n. If you find it challenging to wear contacts during pregnancy, you may opt for glasses until after you give birth. /r/n/r/n. Photokeratitis is a painful condition that occurs when your eyes are exposed to ultraviolet, UV, rays. Think of photokeratitis as a sunburn that affects the corneas of your eyes. /r/n/r/n. Ultraviolet rays naturally come from the sun and are also artificially produced in tanning beds. You can get photokeratitis by spending time in the sun or a tanning bed without sun protection. It can also happen when UV rays reflect off of snow or ice and into your eyes. /r/n/r/n. In addition to redness, symptoms of photokeratitis include watery eyes, blurry vision, and light sensitivity. Symptoms typically resolve within 6 to 48 hours, though they may be more severe if you are exposed to UV rays for a prolonged period. /r/n/r/n. Keep in mind that long-term UV exposure can also lead to increased risk of cataracts, and eye conditions including pterygium, a growth in the corner of the eyes, and pinguecula, a type of eye lesion. /r/n/r/n. It is important that you stop further UV ray exposure. Avoid the sun, tanning beds, or other sources as your eye heals. Remove contact lenses and avoid touching your eyes. Don't patch the eye. You can use artificial tears or take an OTC pain reliever like ibuprofen to ease symptoms, but, if they don't improve within 72 hours, see your healthcare provider. /r/n/r/n. Pink eye, conjunctivitis, is a common cause of red veins in your eye. S. Pink eye is a swelling or infection of the clear, protective layer that covers the front part of the eye. /r/n/r/n. One small study found that 46% of red eye cases documented at a primary care clinic over a few months were caused by conjunctivitis, and another 32% were due to dry eye. Pink eye can be caused by allergies, bacteria, viruses, or toxic substances. It is usually not serious. /r/n/r/n. Pink eye is extremely contagious and can be easily transferred by touching your eyes. Avoid sharing towels or physical contact with anyone infected with conjunctivitis. /r/n/r/n Visit your healthcare provider if you suspect your bloodshot eyes are due to pink eye. This is especially important if it is associated with pain and vision changes. /r/n/r/nrob_land/getty images /r/n/r/n Blepharitis is a common reason for painful, red-veined eyes. It is caused by impacted oil glands that can't release the oily layer of the tear film well. This leads to inflammation of the eyelid. /r/n/r/n Common causes include /r/n/r/n Blepharitis is not infectious and usually does not cause permanent damage to your eyesight. Blepharitis symptoms include /r/n/r/n You may wake up with red, bloodshot eyes if you have blepharitis. Eyes do not produce tears when someone is sleeping, so you could wake up with dry, red eyes due to a lack of lubricating tears. /r/n/r/n Good eyelid hygiene is important. For example, if you have blepharitis, your healthcare provider may instruct you to clean your lids and lashes with eyelid scrubs regularly. If that doesn't help, you may be prescribed antibiotics or other medications. /r/n/r/n Uveitis is an inflammation of the eye's uvea, the middle layer of the eyeball. This condition can occur suddenly and get worse very quickly, leading to serious vision threats. Symptoms include /r/n/r/n Your healthcare provider will most likely prescribe a form of steroids to help reduce swelling. If an underlying cause of the uveitis is determined, that will be treated as well. /r/n/r/n Uveitis should be treated quickly. Complications, such as uveitic glaucoma or retinal and choroidal scarring, may occur without treatment. /r/n/r/n Studies show that eye symptoms occur in about 5% of COVID-19 cases. When eye symptoms do occur, they often appear before other systemic symptoms, such as fever and headaches. /r/n/r/n The most common eye symptoms associated with COVID-19 include /r/n/r/n Eye symptoms typically resolve around the same time that other COVID-19 symptoms do. /r/n/r/n You can use OTC artificial tears to soothe redness and irritation. If your symptoms persist, or if your vision is affected in any way, contact your healthcare provider. /r/n/r/n Dry eye syndrome occurs when there are not enough natural tears to keep the front part of the eye moist, leading to red-veined eyes and irritation. /r/n/r/n Dry eyes can result from /r/n/r/n If you have bloodshot eyes due to dry eye syndrome, it might be helpful to use eye drops that moisten the eyes. OTC lubricant, or rewetting, eye drops can be used throughout the day. /r/n/r/n Redness often occurs with an eye injury. Injuring your eye could be as simple as sticking yourself with a mascara wand or accidentally scratching your eye with a fingernail. /r/n/r/n When you injure your eye, blood vessels inside the eye enlarge and dilate. This brings blood and cells to heal and repair the injury. Eye redness from an injury is a sign that something is wrong with your eye. /r/n/r/n Visit your healthcare provider to make sure that you did not significantly damage your eye. /r/n/r/n A corneal ulcer occurs when the eye's cornea becomes infected, leading to a sore on the cornea. When this happens, nearby blood vessels become enlarged and swollen. As cells rush in to help fight the infection, it can cause visible redness. /r/n/r/n With a corneal ulcer, the nearby blood vessels enlarge to quickly get important inflammatory cells to the site. In addition to bloodshot eyes, symptoms of a corneal ulcer include /r/n/r/n The cornea is avascular, meaning, normally, the cornea does not have any blood vessels in it. Instead, it gets most of its oxygen and nutrients from tears and the air. /r/n/r/n Medicated drops that are targeted to treat the cause of the underlying infection are often used to treat corneal ulcerations. The drops may be antibacterial, antiviral, or antifungal. /r/n/r/n steroids are not commonly started at the beginning of corneal ulcer treatment. However, your healthcare provider may prescribe them to reduce scarring and inflammation once the infection is under control. /r/n/r/n seek treatment right away. Corneal ulcer treatment needs to be aggressive to prevent potential vision loss and blindness. /r/n/r/napalm Getty images /r/n/r/na subconjunctival hemorrhage, also known as bleeding in the eye, causes the white part of the eye to become completely. It occurs when a blood vessel bursts underneath the conjunctiva, the transparent, clear tissue that covers the white part of the eye. /r/n/r/n The blood has no place to go, so it spreads out like ketchup under plastic wrap. Sometimes the blood can gather so much that the eye appears swollen and pouches outward. /r/n/r/n It usually does not cause permanent harm to the eye and is rarely painful, but one study found subconjunctival hemorrhage was common enough to be the third leading cause of eye emergency visits. Common causes include /r/n/r/n Schedule an appointment with your eye doctor. They will examine your eye and make sure that no other damage is present. They may also measure your eye pressure and look inside your eye. /r/n/r/n Sometimes red veins in the eyes can signal a serious condition. One severe eye condition that may cause bloodshot eyes is acute angle closure glaucoma, also narrow angle glaucoma or closed angle glaucoma. /r/n/r/n This type of glaucoma occurs when the fluid pressure inside the eye rises quickly, causing /r/n/r/n Acute angle closure glaucoma is a serious medical emergency that can lead to permanent vision loss if not treated quickly. Usually, a laser is used to make a small hole in the colored part of the eye to drain the fluid and bring the eye pressure back down to normal. /r/n/r/n Episcleritis and scleritis are two somewhat similar looking causes of red veins in eyes. Both are caused by inflammation, episcleritis of the thin, clear tissue layer between the conjunctiva and the deeper sclera, and scleritis of the deeper scleral blood vessels. /r/n/r/n Episcleritis causes mild eye pain, irritation, and eye redness. Sometimes the eyes become tender to the touch. /r/n/r/n Scleritis is a deeper inflammation of the eyeball's outer coat. In this condition, the eye is usually deep red and very painful, with pain sometimes radiating to the surrounding face. /r/n/r/n Often, scleritis is caused by an autoimmune condition, rheumatoid arthritis, for example. Thus, your healthcare provider may order blood work as part of diagnosing your condition. /r/n/r/n Episcleritis can be treated with artificial tears. In addition, steroids can be used if this condition is causing troublesome symptoms. /r/n/r/n Scleritis needs immediate medical attention. It often requires oral anti-inflammatories and topical steroid drops. /r/n/r/n It's best to seek medical attention if eye redness or bloodshot eyes are accompanied by certain symptoms, including /r/n/r/n If you think you may have one of the following conditions, you should get medical attention as soon as possible to prevent serious complications. /r/n/r/n Allergies, pink eye, blepharitis, and dry eye syndrome are also common causes of bloodshot eyes. While they are not cause for concern, you may need OTC or prescription medication to ease your symptoms. /r/n/r/n COVID-19 can cause you to have red eyes, too, but this symptom should resolve as you recover. If eye redness persists beyond your illness, consult your healthcare provider. /r/n/r/n Seek immediate medical attention if you experience vision changes, floaters in your eyes, light flashes, a foreign body sensation in your eye, signs of infection, eye pain, or any other eye symptoms that concern you. /r/n/r/n Bloodshot eyes can result from many things. Most often, the causes of dry, red, irritated eyes are minor, for example, cigarette smoking, lack of sleep, or contact lens discomfort, and can be treated at home. /r/n/r/n OTC artificial tears can help to quickly resolve bloodshot eyes in many cases. Taking an antihistamine for seasonal allergies, avoiding irritants, using a dehumidifier, and practicing good hygiene with frequent hand washing and clean linens are some practical steps to help relieve eye redness. /r/n/r/n However, other causes of red veins in the eyes are more serious and can endanger your vision and overall health. So, it's always best to consult your healthcare provider for an accurate diagnosis. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.